So if the doctor has an MRI, and then the radiologist writes a report and sends it to the GP, and so you've got to get the report off the GP and get the report access to the client so that you can know exactly what's wrong. Because the problem with muscle testing is that the nervous system doesn't always give you the right information. So if you've got a lot of stress in your system and you're trying to interpret stuff from the body, sometimes it's not accurate. And so then you can go off on a wild goose chase. So any report that you get is golden, because it just makes sure that you're actually balancing the right thing. Because when people have lots of stress, their nervous system scrambles and it doesn't always tell you the right information. And that's why you need to be able to feel a body and assess a body as well as muscle test a body. If you're trapped in a virtual world of muscle testing, you can schism off into this little schizophrenic world of kinesiology and not actually do any good for anybody. So the more actual grounded physical information you have, the better results you'll get and the more direct they'll be. So yeah, so there's a lot. So I developed this system like, I don't know, 15, 16 years ago, maybe longer, probably about 18 years ago, of like assessing bones and seeing if the kinesiology registered the bones being in the wrong position. And a lot of the time it thinks it's in the right position when it's in the wrong position. And that's why it's in the wrong position, because it thinks it's in the right position. So then you've got to activate it and then challenge it neurologically and find the stress that's causing the body to give the wrong result. Because if the body had full information about what was out, it would reorganize itself instantly and wouldn't have a structural problem. So a lot of it a lot of our structural problems are around misinterpretation. So if you can palpate the body, identify the misalignments, and then challenge those misalignments with the kinesiology, then you can work structurally so much better. So I know when I worked that out, my efficacy improved probably tenfold, and I went from, maybe seeing 10 clients a week to seeing 24 clients a week and being booked out for 8 weeks. And so that was like almost overnight as soon as I figured that out. And no one else had figured that out. But if you're just trapped in the virtual world of muscle testing, you can't actually assess a body, you'll only ever be a mediocre kinesiologist. So you need to have hands-on skills to be able to assess a body to then challenge the muscle testing. And once the muscle testing's challenged and reintegrated, then you can do anything with kinesiology. But if you can't do that, you're kind of like not great. And that's why you need to be able to locate origins and insertions. You need to be able to locate bones. You need to be able to feel them. Otherwise, you'll never be a great kinesiologist. Which is unfortunate because a lot of people don't want to do that. So I don't have full information, but it seems like it's the anterior cruciate. So we'll just do the pre-checks on Mia. So we'll have a look. And in this semester, we're going to start the structural journey. So after the next course, which is IFIS, we're going to do STF1, STF2. And part of what we're doing is from STF1, which is like working with ligaments, because this is what's not right with Mia today. Governing's stressed. And so, hydration. Okay, then just do the nose thing. Excellent. Alrighty, so could you maybe just bend your knee a little bit and just see how it's feeling now, so we can assess it after we've done the balance? Just feel the discomfort and just see how much it's bending, and then we'll reassess it after we've done the balance. So that you don't have to put yourself in a lot of pain, just the edge of pain. So don't do it too much. Yeah. So just so you because if you just so then after it we can reassess it. But I don't want you to. You've got to be careful when you give people instructions to do things, because sometimes they go way too far. So you don't do it too much, don't do it too much, just so you can assess it. So you've got to be careful. So that's enough, you've done enough. So just so that after the balance we can see if there's a change or not. And when did you do it?
Last Friday.
Okay. So the swelling's probably starting to go down a bit? Yeah, okay. So you probably couldn't move it at all, probably for a couple of days, and then now it's starting to move a little bit because there's less swelling. Alrighty, so we know it's a ligament. So ligament mode is like, remember electrical mode? You got when you do a fist and you touch your little finger and thumb together, that's bone mode. And when you do that deep touch, that's ligament mode. Now, in order to assess ligaments, you've got to do quick movements of the ligaments, like quick stretches of the different directions of the ligaments. Now, would you want to do that on a knee like that? So you've got to do a surrogate. So then what I'm going to do is I'm going to touch the knee. I'll just touch the knee, test the body. Knee's in second stage stress, not surprising. So I clear the second stage stress. With the sacral chakra, touch the knee, now it's indicating. And then I'm going to do surrogate mode. Remember surrogate mode? So I'm going to use my emotional finger on the pad of my palm. Now, I'm not going to do any intentions because it's within her body. You don't have to worry too much about setting up all these parameters because it's within the same body. It doesn't have the same, boundary issues as between two bodies, because you don't want transference happening between the two bodies. So I'll touch the right knee and we'll just see what that's doing. So the right knee's not saying it's interested in being a surrogate. So I'm going to check, which would be unfortunate because it's the best one to work on. So I'm just going to check switching. So switching showing. Okay. So I'll drop the circuit. I'll touch the left knee, which is the damaged knee. And I'll spin it up. I'll do surrogate mode. It's indicating, so it means it's open for a surrogate. Spin it up. I'll touch the right knee. Now it's indicating. So I cleared switching when it didn't want that knee. Balanced the switching, dropped it out, did it again, and now it's saying it's happy for that to surrogate. So I'm just going to make the statement. The right knee surrogates for the left knee for the purposes of kinesiology, and that's indicating. So happy to do that. And I'll just take the circuit. Okay, so now I'm going to test this knee in relation to it. So in STF3, which is in block 4, which is not for a while, we look at the individual ligaments within the knee. I'm just going to show those. So there's a section on the knee joint, and then this is like looking down on the knee joint. So that's the bottom of the tibia. There's the anterior cruciate, the posterior cruciate, the medial and the lateral ligaments. And if we come down here, this is a nice little diagram of the ligaments. So that's the lateral, that's the patella, that's the anterior cruciate, and at the back, that's the posterior cruciate, and on the side you'll have the medial ligament. And they basically hold the knee together. So that's a quick test for you to pull the knee, the tibia forward, the shin bone forward, and that stress tests the cruciate ligaments, so the anterior and the posterior. But then to isolate the anterior, you turn the knee medially, and that activates anterior cruciate. To do the posterior cruciate, you turn it laterally. So you rotate the shin bone laterally, the tibia. So we, from looking at that image, it appears to be the anterior cruciate that's damaged, which is possibly the most crucial, for want of a better word, ligament in the knee joint in terms of stability. Like when that one goes, it seems to have the biggest impact on knee stability. So I'm gonna, I don't want her to do, can we try and pause lock? Oh no, there's no point in pause locking because I'm going to be moving stuff around anyway, so I'll keep it all in my circuit. So I'll be like, and then putting it back and forth. So we'll just get the muscle here. So if I want to do the anterior cruciate, I'm going to rotate this one in like that quickly. So I'm just going to grab the tibia firmly. I can't do loosely, because if I do it loosely, I'm just going to spin the flesh over the bone. And I'm not actually going to move the bone. And if I don't move the bone, I won't stretch the ligament. So if you do this, it's not going to work. Might feel nice, but it's not going to work. So this is for the left knee, but I'm doing it on the right knee, which is kind of weird, but we're doing it anyway. So I'm just going to go like a quick movement. So that's classically, this one's nice. You got a nice tight right one, so it's not loose. Mine are wiggly woggly loose. They've all been worn out over my active life. So I'll just go boom, hold, and it's showing stress. So that's confirming what we've seen in the MRI. And then if I do the posterior cruciate, I'll rotate it quickly out in that direction. So I'll just do that one. It's not showing. And if I lie the leg flat, if you look at the screen, I'm going to create a pivot here and then pull the leg this way quickly to stretch the medial ligament. You see how? So if I go like this, there's a pivot here. Boom. Medial's all right. And if I do this, I'm going to stretch the lateral ligament on this side. And so there's some stress in the lateral ligament as well by the look of it. And then to do the patellar ligament, so the ligament that connects the patella to the tibia, I just pull the patella up quickly. So ligaments damaged by overstretching and tearing. So you don't have a problem with a compressed ligament. You always have problems with stretched or with ligaments. So stretch and torn. So I've got this one, and so I've got the lateral ligament that's showing stress and the anterior cruciate. So I'm going to put those into circuit. So I might do, so give me yes, give me no, I should do them together. No, I should do them one at a time. Do the anterior first, posterior first. So do the anterior first. So sometimes you can do them all together, and sometimes the body likes them done one at a time. So because you can balance all the ligament tissue together, or you can just balance the one ligament. Often depends on what correction it wants. So I've got ligament mode in circuit. I'll just rotate that quickly. Boom. Put that in circuit. It's in third stage stress. Chakra, base chakra, to get rid of third stage stress. The what? I just scanned really with my eyes quickly, sorry. So I'll activate it again. So I'll rotate it in. And hold. And that's first stage stress. So we've got a few different ways that we can balance ligaments. You can kind of stack them all in and look for a correction, often like a cranial correction, or the hologram corrections can be good as well. There's lots of different corrections you can use. But one of the favorite ones is the Meridian stress release. So if you can do the meridian, so if you've activated the tissue here that's damaged, and then you look for a meridian that runs through the knee, like the stomach or something like that, and then you balance, use the meridian chakra release, it opens up the meridian flow around the damaged tissue, and it accelerates the healing process. So I'm going to go, I'm going to check meridian chakra release, and that's indicating. So shall I do it on that one? So I'm going to do it on this knee now rather than that one. So I'm testing that knee, but I'm doing the correction on this knee because that's the damaged knee. So I'm going to check the stomach alarm point. I could check, the stomach's probably the main one. I could check the spleen. I could check the gallbladder. I could check the liver. So the liver one's showing. The liver one runs from here up through there. So is that a priority? Okay. I'm just going to check the stomach again and check frittering. No, so it's just saying liver. Now, interesting thing about the liver is the liver controls connective tissue. So it controls ligaments. So if you balance the liver energy, you're also potentially balancing the organ energy that regulates ligament tissue. So I'll just put that one on. And it's in proximity to the anterior cruciate ligament. The stomach is more proximal, but it's still in proximity. So I wouldn't be balancing ones on the arm. I'd be looking for ones that are running through the knee to balance. And as the energy through the knee heals, it accelerates the healing of the knee. So I'll touch the two ends. So that's the beginning and that's the end here. And then I'll check the type of qi, the jing, qi, shen. And then I'll go light touch, deep touch. And then I'll just go and have a look at poem, meridian chakra release. Do you remember that one? Do you want to see if you can find the Shen under energy options for the meridian chakra release? You want to look it up? Just, come on, look it up. Do you have your book? Look it up. See if you can find it. Because everything in kinesiology is about looking for things. And if you go, I don't know where that is, then you're stuffed. So poem, meridian chakra release, Shen. What? A liver. Poem, meridian chakra release, Shen. What page is it on? 44, that's the table. And then what's the quality, the virtue of the Shen liver? No, the quality, the virtue.
Oh, sorry, highest potential.
Pardon? Highest potential. So, because remember with the poem, it's about movement from the negative to the positive. So the virtue is the highest potential, and what are the options for the pathology in the deep touch? Too many options. Dreamer, cosmic. Can you relate to any of that? Is that under energy? I said under energy, deep touch, which is. All right, I want you guys to sort it out. So if you're treating this person and you give them the wrong thing, it's not going to do them any good. So what is deep touch under or over energy? Under. So what are the under energies in the Shen? So just first one? No options. What's the other one? Okay. Oh. Pragmatism. So that's about being too practical to shut down higher possibilities. Can you relate to that? Okay. Has that been happening for you lately?
After I got a full-time job, didn't have time to do
So got a full-time job to be practical, don't have time to do kinesiology. So, and that happens to quite a few people because of the world. It takes us away from our passion. And so maybe that's you telling yourself that you've got to balance the pragmatism. So your body's speaking to you now, saying you're being too practical and your dream is slipping away. And then your highest potential of how you want to live your life is getting further away. And so then you create this to tell your conscious mind that you're not on track. And so you can thank your body for telling you. But if you're intuitive, you wouldn't have to do it. You'd be listening and following. But if you're not intuitive, then you create calamity so that you listen. All right. So we're moving from excessive pragmatism to following your highest potential. And and that's third stage, and I scan the chakras with my eyes, and it's showing up brow chakra. So now we're opening up brow chakra energy. So from the spirit realm, it's moving through, and that's feeding the liver meridian, balancing the liver meridian at the activated location as it's interacting with the anterior cruciate ligament. The meridian chakra release is golden, like it's really, really golden. So if you kind of forget about it and lose connection with it, big problem, because probably 40% of the corrections that I do in clinic were meridian chakra release. So if you kind of let that one slip by, you're letting a gem slip by. So, any more? So I'm going to come back to this one to test the ligament. So I'll go ligament mode, deep touch, fist, little finger. I'll come back here and I'll just do the twist. So I go boom and hold. I don't try to stress anymore. Now I'll do the lateral ligament? So I'll do ligament mode again. And I'll do the lateral ligament, boom, and hold. And that's in third stage stress. Wasn't in third stage stress before. But, okay. So we'll see if this one wants meridian chakra release as well. And it does. And so, so down the side, we've got the gallbladder, would be the one that's most proximal. So I'll touch the gallbladder on this side because we're actually treating this side. And that's activating the priority. So we're going to do the gallbladder. And that makes sense as well because the gallbladder, part of the wood element, also relates to the ligament. So the gallbladder starts here and finishes on the little toe. So I'll just get you to put 2 fingers here and here, and then letting go, and then hold. I'll go electrical, Jing, Qi, Shen. And what was that one for the gallbladder? For Shen, the virtue? Transcendence. And what's the description of transcendence? Okay, so it's so it's transcending the dualities. So it's like, it could be like, I really want to do kinesiology. I let go of lots of stuff, run out of money, go back and earn money, and then let go of kinesiology, and then come back and do kinesiology and let go of money and not finding the balance. So that could be like, that oscillation back and forth between things could be. And so, and what are the, so we're going to check if it's light touch or deep touch now. So light touch, deep touch, so it's deep touch as well. And so is deep touch under or over energy? Under, very good. And so what's the first one? Locked into patterns. Trapped in dysfunction. So trapped in dysfunction is showing. Stuck in dysfunction. Okay. So you're moving from the dysfunction of being oscillating between things to moving into transcendence, where you're kind of like balancing the polarities and passing through towards your highest potential. And then we'll check chakra, and it's sacral. Excellent. So stuck in dysfunction, transcendence anymore. And I'll come down here and check the lateral ligament. So I'll put ligament mode on again and do this. That's good. And so the ligaments are clear. So I'm just going to do the ligaments. So I'm going to drop the circuit. And and that's also dropping the surrogate circuit as well. So I'll just to make it clear, I'll just say this knee is now itself, this knee is now itself, just to break any lingering effect of the surrogacy. And then I'll just get you to move this a little bit and see if there's any change. Yeah, you bent it a lot further. Can you see the difference in the bend? Yeah. Yeah. But the main thing is like, there's going to be massive swelling around it and fusion around the joint. And it's not gonna fix because it's inflamed and swollen straight away. However, it's gonna accelerate the healing process because the energy's moving through the meridian. And ligaments take a long time to heal because there's not a lot of vascular tissue around them. So they slowly heal. They don't heal quickly, but this will make it go a bit faster. So another thing we could do is perhaps looking at the fascia, because the fascia is affected a lot by inflammation as well that's created by the swelling. So if I put fascia mode on, so you're going to learn this in SDF1 this semester, the fascia, so it's not far away. So I'll do tissue mode, fascia point, heart 4. And then I'll do continuous recording mode, and I'll just get you to move your knee a little bit. Right here. Don't hurt it, just keep moving it. It's looking pretty good, isn't it?
Yeah, only the top one that is a bit.
You can feel the tightness there. And then, okay. So we're just activating. We don't want you to hurt yourself, so just keep it. So that's showing stress. And then I'll get you to put your feet together apart for a sec. That's it. And so I feel more comfortable activating it now because we've cleared some of the stress in relation to it. Now I'm going to put the immune vial on, which is dealing with the inflammation in the tissue impacting on the fascia. So when you have inflammation around, the fascia tightens up. So I'm going to treat the inflammation with the immune as I balance the fascia. So I'll just put this into the field, it's activating. And then I'll put fascia on again, because I put fascia on in the beginning, moved it with continuous recording mode, put the vial on to treat the inflammation with the fascia. And now I'm going to do the fascia correction. So I'll put fascia on again. Now, the way I envisioned fascia was an extension of the etheric body. So the etheric body is like this grid of fine web-like energy that surrounds the physical body, and it penetrates into the physical body through the fascia. And the etheric body basically informs the physical body of how to organise itself and function at a physiological level. So to treat that, I'm going to go look at the components of fascia. So it has like muscle type tissue, it has connective type tissue, it's hollow and full of water, and it looks like the etheric body. So I'm going to put auric field mode on, etheric mode on, chakra. And so now the chakra energy is penetrating into the fascia tissue, allowing it to reorganize. And as we do that, we're also treating the inflammation. So you'll probably find this will reduce a lot of the inflammatory restriction around the joint as the inflammation and fascia are addressed together. So when you have inflammation, the fascia tightens, which is part of the healing process, but is also restrictive. Okay. So do you want to have a go at moving it again? Very different? Much freer? Cool. So now, just to clean everything up, in SDF 2, which is at the second last course of the semester, we're going to look at magnetic stress release. So I'll get you to put your feet together apart. See that? Just put a foot together like that. And what I'm going to do is I'm going to use the magnets. So the North Pole magnet's like a chi pump. So it basically projects chi into the body. I learned that from Dan Winter. And I'm just going to go around, and then it wants it there. So I'll just go here. So what's happening is chi is now pouring in to the body through as a North Pole magnet. But the body doesn't necessarily know what to do with the chi, doesn't know how to organize it. So then it opens up the potential for a chakra. So the base chakra is opening up, scanning with my eyes. And so now information is pouring in through the base chakra to appropriate the chi that's pouring in through the magnet. And then when in the healing process, your body needs to like eject chi as well, like stagnant chi needs to be thrown out of the body. So you're pumping chi in, the body's like organizing it, but then we've got to create an exit for stagnant chi. So Paul, would you be able to come up and hold this? Just stand over there so the camera can see what's going on. Cool. So then the chi exit points are kidney 1, so using the South Pole magnet because that sucks chi out. And then heart 8. Heart 8. So this heart 8 is the exit point in this case, and the brow chakra. So the information's pouring through the brow chakra to allow the chi to exit through the heart 8, also called Lao Gong. Pardon? Lao Gong. That's the name of the point. Cool. That should be enough. Thank you. And then just chill, and when you're ready, just try the knee. Good? Yeah. Well, don't stretch it too much. Don't get too carried away, because it's freer, but it's also still healing. So you just want to be gentle with it. Even though it feels a lot better, you might go, "Oh, I feel good," but you don't want to put any stress on it. You want it to be looked after for a few weeks. Thank you. Cop on cop.
Got a question. So when you had a fascia mode on, we talked about hologram
Well, that, you see, it's just related to that. Well, because what I did is I put fascia mode on, and then I held continuous recording mode, and then I asked her to move her knee. And so she's moving her knee back and forward, and so then it's active. So fascia is the context, put that in circuit. Then the next context is the location. So then I've got the location activated. Then after that, I put fascia mode back on again, then put the immune vial, actually I put the immune vial back on, so then I'm dealing with inflammation in that area. And then I put fascia mode back on again and then do the correction. So it's like, everything is like contextual. So first context is the fascia, second context is the region of the fascia, and then the next context is the immune inflammation, and then the fascia in relation to the immune inflammation. Because the fascia is tightening because of the tissue damage, releasing inflammatory factors. So just a little bit of a digression into structure, but it just sort of shows you as well where the kinesiology, different directions of where the kinesiology goes. And you can see clearly, you know, the structural changes. It's such a powerful structural tool, kinesiology. You know, it's really potent. And, you know, often people think, oh, it's about your emotions and stuff. And it is, because she created that to tell her that she's being too pragmatic and not putting enough energy into her dream, which is the kinesiology. And so then she created that as feedback because she wasn't listening. And so that it wouldn't properly heal either if it wasn't part of that. But if you just did that and didn't engage it into the actual tissues, it wouldn't work as well either. Do you know what I mean? So if you just did it structurally, you wouldn't get the same result. If you just did it emotionally, you wouldn't get the same result. But when you blend the two together, you get the ultimate result. And so kinesiology has to look at everything together progressively as you're moving through. You can't just... There are a lot of kinesiologists who aren't well trained. They just clear emotions. And people feel better, but it's not necessarily going to engage the changes in the body because they don't know how to get to the different tissue layers to make it happen. So we don't want to be one of those.